how does restricting carbohydrate affect our cholesterol?
Well, the effects of diet on lipoprotein metabolism and cholesterol metabolism has been an interest of mine, and it's more than a bit complex. But we've certainly done a lot of work in that area, and I would start off by saying there are a couple markers that consistently change with low carb, and we talked about triglycerides go down consistently, and that's almost always followed by an increase in HDL, which is considered, both of those are considered, very favorable in terms of your cardiovascular risk. Now, most people like to focus in on the LDL cholesterol, though, as a primary target for reducing risk for heart disease. And I have to say, what we've seen with LDL cholesterol concentration is quite variable. You will see some people decrease, perhaps dramatically. You'll see some people increase, and you'll see some people stay the same. So I think there's some genetics going on there. We've seen this in feeding studies where we feed people the exact same diet for 6 weeks, and we see very uniform changes in triglycerides and HDL, but LDL concentration is quite variable.
Independent of weight loss?
Independent of weight loss. So under weight-stable conditions, this occurs. However, what is more consistent is more the qualitative features of LDL do improve consistently, which is consistent with what we know about the heterogeneity of LDL cholesterol. Those particles range from very small to larger, more buoyant particles. And it's the smaller, denser LDL particles that are more atherogenic, that are more highly associated with risk for heart disease for a number of reasons. They probably penetrate the arterial wall more easily, they're probably more prone to oxidation and so forth. But some very good work has shown it's those particles that are most dangerous. And we consistently see a low-carb diet makes those LDL particles bigger. And the terms that have been used to describe those smaller particles, if you have more of those, you're considered a pattern B versus a pattern A, which you have more of the larger fluffy LDL. So we consistently see people switch from pattern B to pattern A with a low carbohydrate diet. So even if you happen to be one of the people that see perhaps a moderate increase in your LDL cholesterol level, it's almost always in the form of the larger, less atherogenic LDL particles. And I think there's other reasons that LDL cholesterol may go up in people losing weight rapidly. And Steve made this observation many years ago